Good afternoon, everyone. So I am from Pilani as well, and we have been involved in a pilot project with the Department of Health as an implementing partner for a project called Catch and Match. This is a project where community health workers are delivering comprehensive care. So the community health, the Department of Health's idea is for community health workers to be giving comprehensive care in those 5 fields that I've mentioned: pregnancy care, postnatal care for children under 5, adherence support and wellness promotion, and home-based care. There's a strong focus on the first 1,000 days, maternal and child health, which is partly why Pilani was chosen as a partner with our mentor mother model. So how do we deliver this service? For Catch and Match, we've changed the Pilani model slightly and reduced it from 500 households to an area of 200 households per community health worker. And they do house-to-house screening using the provincial household assessment screening tool, and they also screen individuals in the household. Any pregnant mother or child under the age of 5 has additional screening, and an additional clinical folder is opened, and those children are followed up more regularly. And then each group of 10 community health workers is supervised by a coordinator. We have 3 pilot sites for this project. The first is in Delft with Touching Nations, the second is in Nyanga with St. John's, and the third is ourselves in Pilani at Site C in Khayelitsha. So the catch part of the program is the screening of children to try and mothers to try and identify those who might be at risk. In addition to the screening process, I also just want to emphasize the home intervention. There's very practical things that can be done in the home. All the community health workers are trained in counseling skills to support the moms in giving health information, weighing the children. They also check the road to health booklets, they give missed doses of vitamin A, and they're able to do pregnancy tests in the home. Those are just a few of the things that they do in their home visits. The match part is, once a risk factor is identified by a community health worker, is to then refer the client to the service that they need. And this might be health services, but it might also be a different kind of service, like getting an ID book for the mother, or a child support grant for the child, or an environmental health issue. So there are a variety of service providers. We have developed a referral letter which the client takes to the service provider, and we've asked that they just sign that form. They don't have to fill in a lot of detail. Return it with the client back to the community health worker so that she can confirm linkage to care has happened. An exciting part of this project has been to develop a mobile health application. We've done this with Mabenzi, and it's an application that the community health worker has on a phone. The picture just shows the sort of home screen of the phone with the different modules that she can do. So the household assessment form has been fully digitized, and so she does the screening of the household, screening of individual members exactly as it is on the paper, now on the phone. We have incorporated some of the screening algorithms for pregnant women and children under 5 onto the phone as well, although not the complete folder, so they still open folders for all the children and pregnant mothers. She's also able to do ad hoc screening for HIV, TB, and pregnancy tests. And another thing we've developed is an electronic referral loop, which I'll talk about in a minute. I just thought I'd highlight a few design elements of the system which have been really nice. The system firstly adapts to the information that's inputted. So, for example, if you have a female client, it will automatically generate questions about whether she wants a pregnancy test or whether she wants family planning. Another example would be a child client. All the child clients must be weighed on every visit, so that comes up as a field that has to be entered. So it adapts to the individual information that's being entered. The screening also includes an assessment of risk factors. So for children, we look at growth risk factors, like low birth weight, growth faltering, underweight for age, stunting. We also look at medical risk factors, particularly related to HIV and TB, and we look at some social risk factors as well. Similarly for the mother, the health and social risk factors that I've listed. The system also alerts the community health worker to outstanding or recommended tasks. So in this screenshot that I've included of an individual client who has a variety of activities available, the one that's highlighted in yellow is telling her there's something that needs to be done for this client. There's an outstanding task that needs to be done. So it helps her to manage her work in the field. In addition to this, clients who have had a risk factor selected in the screening will be flagged in the system. So it would show the client's name with the risk factors listed underneath. The system is also able to indicate referrals. It can suggest referrals. So depending on the information that's been added in as she's screening her clients, it will suggest. So, for example, she might put in a child who's not getting a child support grant, and at the end of the screening, referral will come up to say, do you want to refer this child for the child support grant? So I said I would come back to the electronic referral loop. How does this work? The community health worker refers her clients to the health facilities. So the mobile phone will generate a list of referrals which is stored on the mHealth platform. This now goes through an interoperability layer to the Provincial Health Data Centre. The Provincial Health Data Centre receives information from all the clinics, the hospitals, the laboratories, and it looks for matches of clients that have been encountered at any health facilities to this list that's generated by the mobile health platform. If a match is found, the information goes all the way back to the mobile phone and a notification is issued to that community health worker that that client has been seen at a specific health facility. So the last task that she has to do is to visit the client and check, did the client go for the same reason that she referred them? That it can't tell her, the reason for attending the facility. The important thing with this is that it doesn't require somebody sitting in the facility to enter something on a computer or on a tablet. It's all completely automatically generated. So in summary, that's a nutshell of the Catch and Match project, and obviously our intention at the end is that we'll end up with healthy mothers and healthy children. Thank you.